The pediatric clinical was really fun. I feel like we do learn a lot and get to see a lot during our rotations at Children's, but it's a lot of observation and not so much hands-on. So CSI was a really fun opportunity to get to practice our skills and just be more involved with the patient. After reading my feedback with the Xavion scenario, I think I did a good job communicating with the patient, and I did work with kids before nursing school and a little bit during nursing school, so I do feel pretty comfortable with that, but working in a healthcare setting and communicating is kind of different, so I'm happy that that did carry over. Cons, I did have difficulty navigating the VR space, which I think with practice and just more time in the VR space, I'd be more comfortable, but I feel like I didn't really accomplish much during the scenario because I was just trying to figure out what all the buttons were. Takeaways, I did learn a lot about sickle cell, especially with our debrief. Mr. Otto was very informative and just kind of covered everything. We learned about the treatment, what kind of pain they're experiencing, and interventions, and then also that they might be working on a cure. So that was really cool. For my scenario with Lucas, sorry about my cats in the background. Anyways, my scenario with Lucas, I feel like we did a really good job working as a team and delegating tasks. And then I was in the moment a little worried about leaving my scenario to help with the other scenario. But afterwards, I realized that that was the right move because I was choosing between maintenance fluids or potential like airway problems. So I think I did make the right call in that situation. So I would say I did a good job of adjusting as my priorities changed. Cons, I was really struggling with the IV pump, which I did take time after the scenario to just look at the IV again because I could not figure out where to do like just a saline infusion, but I feel a lot better about that now. It definitely slowed me down though. Takeaways, I am a lot more comfortable delegating and communicating. I think in the beginning especially, it's hard to like delegate and be like, you should do this when I don't even know what anybody should be doing. And I know I do still have a lot to learn, but it is cool kind of getting more comfortable and having kind of an idea and trusting your gut and feeling a little bit more like a nurse. I also got to see the challenges of the pediatric population, especially with communication, because with most of your adult patients, you can be like, where's the pain at? What does it feel like? When did it start? With the pediatric population, you're getting that from a parent, guardian, or if you don't have that, you're trying to gather it from like whatever you can gather from the child, subjectively, objectively, whatever. So it's definitely a bit more challenging. And then also navigating family interaction and stress. I think anybody is stressed when their loved one is in the hospital, but when it's your 3-year-old baby, that's obviously a lot more stressful and a lot more emotions involved, but I do feel more comfortable in those situations. I feel like it varies so much on the situation, but I do think that this was a good experience. And one thing that I feel like I improved on during the simulation compared to other simulations and even just being at clinical, it's easy to get overwhelmed when something's going on, and I've realized that like if I just focus on one thing, that helps me a lot. Get this done, move on to the next thing instead of just letting everything overwhelm me. And then for my QI project, I think that we had a couple of situations where there was potential for med error or calculating meds really slowed us down. I think a part of that is just because we're not super confident being put on the spot, like do med math right now, but that is our concern in the real world too. So I think a good quality improvement project would be having 2 nurses verify the drugs in an emergency situation. I don't know how well that would play out in real life, but I think it's worth looking into. Thank you for your time.